Good evening, everyone, and welcome to Congresswoman Sherrill's Telephone Town Hall. My name is Jill Hirsch, and I am one of the Congresswoman's District Directors, along with Kelly Doucette, who is also on the line and will be bringing you live for questions. This pandemic has been hard on so many, which is why this evening our town hall is focused on mental health. While we are waiting for everyone to get on, I'm quickly going to run through some of the logistical information for tonight's event. We will begin the town hall with opening remarks from the Congresswoman. After that, the Congresswoman will introduce her guests and pose a pre-submitted question to each of them to get tonight's discussion underway. We received so many great questions before the town hall even began, so thank you to everyone who submitted. After this, we will open up the line for questions. If you would like to ask a question, please press *3 on your phone at any time, and you will be connected with one of our staff members, and then put in the queue to ask your question live. When you are given the opportunity to ask your question live, Kelly will call on you. Please try to keep the question brief so that we can get to as many questions as possible in the time that we have together tonight. If we do not get to your question today, you can email it to the Congresswoman or go to our website at sherrill.house.gov/contact. If you have a question regarding assistance with a federal agency, please feel free to ask your question and your call will be promptly returned by one of our caseworkers, who are also on the line with us tonight. You can reach out to our office at 973-526-5668. As tonight's topic is focused on mental health, if you or someone else you know needs any assistance, there's a list of resources available on our website. At this point, let's get started. Congresswoman, I hand it to you.
Thanks, Jill. Hi, everyone. This is Congresswoman Sherrill. Thanks for tuning in for tonight's telephone town hall. I'm so grateful to be joined by an experienced group of mental health and medical experts, Bob Davison, Dr. Deborah Koss, Fred Douglas, and Dr. Charlene Gungil. Thank you all for being here tonight. And before we hear from them on the important topic of mental health, I want to begin with a quick update on the work I've been doing over the past few weeks. First, I want to update you after my recent trip to Brussels and Kyiv on a bipartisan congressional trip led by the House Foreign Affairs Committee. Although I don't sit on the House Foreign Affairs Committee, I'm glad to be there in my capacity as a member of the House Armed Services Committee. HVAC and HASC both share a commitment to halting Russian aggression, but our committees have very different focuses and areas of responsibility. It was important to have HASC representation, and I found it incredibly valuable to be on the ground to hear the concerns of Ukrainians and their security assistance needs. This bipartisan trip gave Ukrainians a clear message. The U.S. government is united behind them, and all of us were deeply encouraged by what we saw, both in Brussels and Kyiv. A more unified Ukrainian people, a unified NATO, a unified transatlantic relationship, all determined to stand up to the looming threat from Putin's Russia. In terms of domestic issues, of course, COVID continues to impact all of our lives, and we'll be addressing that with our panelists shortly. As communities continue to assess for COVID recovery, I continue to fight to get resources directly back to NJ11. Last month, the Treasury released the final rule for the state and local COVID relief funds that I'd been advocating for months. So I was thrilled to see it allowed for the increased flexibility I asked for after hearing from local officials who wanted, for example, to be able to invest these funds in expanding the recreational space that was so important during COVID, or on services like recycling because of the increased need due to people working from home. We look forward to hearing how our towns and counties use these funds, which were based on a provision in the SMART Act that I introduced in the House for our communities. I've already heard about great ideas to use this funding to help those who need it most here on the ground in NJ11, including to help small businesses, like the Morris County Grant Program being launched next week, offering up to $15,000 for small businesses with less than 25 employees. It's also being used to tackle water infrastructure issues, like in Peckman with PFAS remediation, and to look at projects that range from expanded recreational space to purchasing new emergency response vehicles to expanding warehouse capabilities for pandemic resources like PPE. There's also tremendous opportunity for NJ11 in the Bipartisan Infrastructure Investments and Jobs Act as well. We've already had exciting news on the Portal Bridge and Gateway, which will have a huge impact on our area and will help our communities gain back valuable community time they can instead spend with their families. Funding from the infrastructure bill has also been allocated directly to clean up the Unimatic Superfund site in Fairfield, New Jersey, which is really exciting. My team's focused on getting information on the grant opportunities out to local officials so we can ensure that NJ11 receives every penny it's eligible for. This includes sharing resources like the Guidebook of Infrastructure Grant Opportunities that came out this week, and hosting a call next week for mayors with representatives from the U.S. Department of Transportation to talk through these opportunities in detail. Finally, I want to talk about some exciting news one of our projects addresses related to flooding in NJ11. As you all know too well, our communities and families across northern New Jersey have faced the dire and sometimes fatal impact of devastating flooding in this region for far too long. This has been a focus of mine since my early days in office, and I've hosted the Army Corps and NJDEP and NJ11 multiple times to discuss these issues and move projects forward that are in process across the district. One of these projects, the Peckman River Basin project, was at the design stage after having the Army Corps Chief's report signed in 2020. Last month, we were able to secure $146.2 million of funding to complete this project out of the Ida Disaster Supplemental. This is a huge win for NJ11 and for the residents of Little Falls and Woodland Park, whose lives will be substantially changed by this construction. The issue of flooding affects every corner of NJ11, and I'll continue to work in Congress and with our partners NJDEP and the Army Corps on ways we can address the historic problem. Moving on to our focus for tonight, mental health, I'd like to introduce our panelists. I'm grateful to have some incredible expertise in the area of mental health resources. We have Bob Davison, CEO of the Mental Health Association of Essex and Morris, Child and Adolescent Psychiatrist and immediate past president of the NJ Psychiatric Association, Dr. Deb Koss, who has practiced in Sussex for over 20 years, and Fred Douglas, a school counselor at Parsippany High School and president of the Morris County Professional Counselor Association. And, as we've frequently had on these town halls throughout the pandemic, we're joined by an incredible medical expert, Dr. Charlene Gungil, Director and Health Officer of the Passaic County Department of Health Services. Thank you all so much for joining us tonight. So with that, I'd like to get to questions. We had quite a few pre-submitted for tonight's town hall, so I'll start by asking each of our guests questions on topics raised in these pre-submitted questions. If you have questions, you can dial *3 on your keypad at any time to be connected with someone on my staff, and you'll be placed in the queue to ask your questions live. So Dr. Gungil, I'd like to start with you to give a little context to our discussion tonight. New Jersey was hit hard by the Omicron variant, but positive cases have now returned to pre-Omicron levels. Can you give us an update on the status of COVID in New Jersey right now? And thanks again for joining us.
Thank you, Congresswoman. Good evening, everyone. It is my pleasure to be here on this panel. So as of today, New Jersey has now 1,490 PCR-tested cases and 224 antigen-tested cases. Today, the hospital reported deaths are 40, and with an overall 29,047 New Jersey residents who died due to COVID. The sad part about these deaths is that currently 90% of our deaths are of the unvaccinated people, with a very small percentage of immunocompromised vaccinated people. In other words, this is now a disease of the unvaccinated. We have currently a rate of transmission of 50.52%, which is very low, which is very encouraging. Today, the governor also announced the removal of the mask mandates in all schools and child care centers throughout New Jersey as of March 7th. Of course, as a home rule state, individual districts can address policies based on their COVID-19 status in that particular location. And that's the overall update I wanted to give. I also wanted to mention Congresswoman, that our vaccination efforts have been very rewarding. Right now, over 14 million vaccinations have been administered in New Jersey, and we have almost 7 million fully vaccinated people. The one area that we're very concerned about with vaccinations is that booster shot. We have a 51% rate of boosted individuals, and we have learned that it really is important for especially immunocompromised people to get that booster shot, because without it, their immune system is not as strong to respond to the COVID-19 exposure. So that's my overall overview, Congresswoman.
Well, thank you, Dr. Gungil. As always, that is incredibly helpful. Bob, I'm going to turn to you next. You've also joined me for previous town halls throughout the pandemic, and from early days, you highlighted that even once we had COVID under control, the mental health implications of the pandemic would continue to be a long-term issue. As we hit the 2-year mark of the pandemic, what are the primary issues you and your colleagues at the Mental Health Association of Essex and Morris are seeing in terms of the mental health of our community? And are there resources that you want to highlight for people who need assistance and are not sure where to turn? Thanks again for being here.
Thank you, Congresswoman. What we've seen here and throughout the district and throughout the state and throughout the nation is, as a result of the pandemic, an increase in anxiety, depression. Among younger women, we've seen an increase in eating disorders. Among younger men, we've seen an increase in gambling, particularly internet gambling. And these disorders and these issues have, for the most part, ebbed and flowed along with the course of the pandemic. As the pandemic got a bit better in the summer and last fall, we saw a reduction in some of these issues. Given the current wave, we've seen an increase. But I do remain hopeful. Most people can recover and do recover. In fact, I hasten to point out we've also seen some post-traumatic growth as a result of the pandemic. We've seen people learn to be more empathetic towards others. They report that. People report that they've learned positive coping behaviors in regards on how to handle stress and anxiety. People report that there's an increase in their desire to give back, and they feel more confident that they can handle challenges that life hands them. So while the pandemic has been very stressful, it hasn't been all bad news. In regards to resources, anyone that needs help, we certainly encourage them to reach out to us. And they can contact us via our website, mhainspire.org. That's mhainspire.org. In fact, we were able to set up a program in response to the pandemic, a crisis counseling program, if you would. And it's the New Jersey Hope and Healing Crisis Program, and it's funded by FEMA, and that was funding that you advocated for, Congresswoman, so thank you very much. Please reach out to us. We will be able to help you, and if we can't help you for some reason, we'll be able to refer you to a bevy of resources throughout the district. For example, Main Street Counseling Center in West Orange does an outstanding job. Newbridge Services in Parsippany does an outstanding job. So hopefully we can help you, but if we can't, we'll find someone that can.
Well, thank you so much. I really appreciate it. And I am glad to hear that you're seeing signs of people developing more empathy and a desire to give back, because I think what's been so heartbreaking that I hear, what I hear time and again from members of our community is that in the face of this crisis, we're still seeing so much division. So hopefully we'll start to see that heal in the wake of this as well. And unfortunately, the mental health challenges of COVID aren't going away yet. And some of the mental health challenges seem even more pronounced now. The last time we spoke, Dr. Koss, our conversation focused on just getting through the pandemic. But as we start to get back to our new normal, what advice do you have for children who are having to relearn how to navigate in-person social situations and really just being out in the world again?
Thank you, Congresswoman, for organizing this town hall and for sharing that timely question. We know that children and teens develop their social skills through practice, through trial and error. And many of us, our children included, are feeling out of practice at this point. So our early efforts at helping our children to get fully back into community, back into their extracurricular and their social activities is going to need a little bit of intention and support. I think one of the first things that parents and family members can do is to create an atmosphere at home where we invite our children to share their questions, their thoughts, and their feelings with us. When we as parents better understand what our children might be anxious about, we can then be more on point in terms of providing support. I also think that we as parents can work with our children on setting up baby steps for helping them to get integrated back into community. And these efforts may be very specific to our children's ages and stages. So our preschoolers and our early grade school children might be somewhat reluctant to separate from family, from home, after spending extended periods of time together as a family. And so we may need to create some opportunities or identify some opportunities where they first enter into activities with a sibling or a close friend, that they begin to integrate back into play dates and social dates that are structured and time limited, so they again build that confidence in being away from home and engaging with their same age peers. These efforts may look a little different when we're working with our teenagers, our middle school students, our high school students, who most likely have remained engaged with their peers through social media and a virtual platform, but may not have had the same type of experience or practice with in-person social events or in-person extracurricular experiences. So again, talking with our teams, inviting them to let us know what they might be anticipating or what they might be worried about would then allow us to validate their feelings, help them to construct a plan that allows them to get back into community, to see their friends, to build their confidence and engaging in all of these age-appropriate activities. We've learned a lot through the pandemic, and we know that our children need to be in-person learning, in-person experiences in community, helps with academic development and social and emotional development. So we want to be right there supporting them in these next steps. And parents never need to go it alone. We've got tremendous resources available to families through our school districts, through our pediatricians' offices, to help families to feel like they're part of a team where they've got the support and the resources that they need. And we've also learned that kids are resilient, and so we know with the early intervention, with the appropriate kinds of mental health supports and services, we can help children work through their emotional distress.
Well, thank you so much. And, I can just tell you as a mother of 4 kids, it was really a struggle, and you always felt this sense of guilt that somehow you weren't doing enough to get your kids through this pandemic, and now it feels really overwhelming as we're back to what I call the new normal. It doesn't feel like it did before the pandemic, and you're constantly worried about whether things are going to shut down because of COVID or how you keep them open. I was recently traveling, as I mentioned, to Ukraine, and I was a nervous wreck that I would somehow get COVID, and if I did, would my kids have to stay home? And it's so difficult to kind of navigate all of this and keep your kids safe and keep them, as you said, in-person school, which I noticed with my children has been so incredibly important to them, sort of getting back on their feet after a long time being quarantined. So I really appreciate your insight and your discussion of services. I think that's so important. So now let's see. I'm going to turn over, speaking of schools and what you're seeing there. Fred, thank you so much for bringing your perspective this evening as a school counselor. I know I've heard from so many of our teachers that a lot of our kids are really struggling with the social, emotional component. So can you share a little bit about what students and teachers are trying to do to balance now as they continue to navigate COVID? What signs should parents be looking for, and what's the best way to talk to your children about how they're feeling and what anxieties they're dealing with at this time?
Sure. Thank you, Congresswoman, and thank you everybody for such great suggestions and good advice. I like the segue as well. Thank you for including those remarks about contacting the resources at the schools. Most of the school counselors, in fact, I would say 95 or 100, close to 100% of us, are optimistic, familiar with crisis and difficulty, and we were very well aware of what was going on in family structures and mental health situations pre-COVID. COVID has now affected everyone. No one is excluded, and the services and the demands that are provided reach everyone. On top of it, you all referenced the horrific loss of caregivers and relatives and others. So that's a significant issue for the kids as well. But one thing I can say for sure is that the students and the children, even from the time they leave their home and head to the bus stop or get going in the car to school, you'll see uniformly that they're ready, they're excited. For the most part, they understand the requirements and they're following the guidelines extremely well. And our students in Morris County especially have fulfilled over many years a lot of the things that we expected. They adjust well to trouble, and so this has not been that much different. I mean, it's certainly a bigger and more graphic situation, but by and large, the students have found their way, and they're catching up socially, as we just heard. There are lots of new experiences, friends that they don't recognize, kids that have changed circumstances, family structures, things have happened. But by and large, the socialization is happening right on schedule, and kids are busy. Certainly that's not true for the kids that have had the struggles, who are missing school or developing lots of the related issues we just heard so much about. And so we do see lots of that. But remember that we work in a school. The counselors are basically on approximately a 7-hour day with hundreds of students in each of our caseloads and lots of families to be working with. So we're not a mental health agency, but we certainly have everyone's best interest at heart. And so we do what we can to respond when we see something, and we also have a lot more proactive approaches going with all the social emotional needs that we are well aware of. Thank you to the resources of the community. Morris County has among the best you can imagine for help when we need it, and they are very present, if you will, on call at all times, just as we just heard. So one thing I would say to everyone calling in is that if you have children in the schools, you have a school counselor. You may not have spoken with him or her recently, but they're there and they're waiting and they're interested and they do care. So for those of you who are not sure how or what we do, which is pretty much everyone, because the school counselor role that you may remember when you were a student is far different from what the school counselors are doing today. So we are excited to be around the children. We like to be with the teachers again. The instruction is active and going along very well. The gap we see realistically is that teachers are, much like the other adults even on this call, concerned about what have we lost, or what are we catching up to, and where do I fit this into my coursework and my curriculum. And that's all understandable. But you have to meet your students where they are, and students come to school ready to go. They give you basically their best every day. And so when you see at home evidence of trouble or surprise or changes in habits like sleep habits or diet habits or quietness when you have an outgoing child or any of those kinds of things, certainly a phone call to check with your school counselor for one. Your pediatrician is a good place to go. Your family members, other family members is a good suggestion. But the main thing we like to do in the school is keep everyone informed. Stay active, stay connected, and let us know your questions. We can't really help somebody if we don't know they are in need. So I'm happy to be part of the call. I'm excited to hear some of the questions. I do want to remind everybody that we happen, even though it's a kind of a negative tone to the COVID crisis, we remain the best state in the nation for handling crisis, best state in the nation for producing quality students in the public school setting. So we were strong before the crisis hit, We've remained strong. We have a lot of our support from our federal and local agencies. We have all of our community agencies staying active throughout. So if there is anybody ready to handle this kind of a situation, it's the New Jersey group as a whole, and specifically where we happen to be very fortunate in Morris County. I was very touched when I heard Congresswoman mention the phone call we were on, because the same issues that she was describing a few minutes ago tonight reminded me of some of the things we were talking about then as well. So motherhood is my favorite topic. And with that, thank you. Thank you.
Well, thank you. And thanks for all the hard work you're doing, because one of the reasons that we are best able to handle this is the great people that work for our school systems. And I just know from dealing with COVID for my own 4 kids and talking to their teachers and watching them on some of the Zoom classes, the teachers have really had an incredibly heavy lift over these last couple of years. So thank you. I'm sure counselors have had an equally, if not heavier, lift with the struggle. So I really do feel great that we have such wonderful resources here, and thank you for everything you're doing. So I am going to turn it over now to Kelly Doucette. So if you have any questions, you can dial *3 on your keypad at any time to be connected with someone on my staff, and you'll be placed in the queue to ask your question live. So Kelly?
That are coming in. We also had asked for some pre-submitted questions through a form when we publicized the town hall, and we want to get to one of those first. A topic that came up a lot was inflation and the rising cost of goods in New Jersey right now. Residents wanted to know what Congress is doing to curb this.
So I'm sure some people are wondering why we're talking about inflation on a mental health town hall, but I can tell you that it is an incredible stress on so many of our families with rising prices throughout the district, and I have been concerned about this and been working to address it through some regulatory work with our agencies, and now through some of the legislation we've passed. So the pandemic damaged and exposed issues in our nation's supply chain. In fact, at the beginning of this Congress, I was on the Defense Critical Supply Chain Task Force and the Armed Services Committee to address some of the issues we were seeing in our defense supply chain, but certainly it is not limited to that. So we see those critical issues and the damage to our nation's supply chain driving inflation and raising the cost of crucial goods such as groceries, gas, and cars for New Jersey families. With 4 children myself, I make a lot of Costco runs, and a gallon of milk being $3.75 is tough to see, as well as gas, close to $3.50 a gallon. So these costs are hard on families, especially those that are commuting. That really starts to eat into your pocketbook and deeply frustrating. It's why I voted for and helped shape the America Competes Act, which passed the House on Friday. I had 7 amendments into that bill to help strengthen our supply chain and reduce inflation, increase our competitiveness with China, and bolster research and development initiatives that are critical to innovation and GDP growth in our nation, particularly in a place like New Jersey with so much inflation going on. So I made sure the bill included a section to ensure the funds are spent responsibly and to actually reduce the inflation. To combat inflation, I also authored an amendment to help critical supply chain sectors like trucking and warehouse industries hire and train more workers quickly by expanding access to our national apprenticeship system. And I was proud to work with Representatives Tim Ryan and Norma Torres to ensure the bill works to address supply chain disruptions and establishes a supply chain database for our manufacturing sector. These will help us to reduce supply chain problems and prices in New Jersey, and I'm going to continue to push to improve the legislation and ensure it's signed into law as soon as possible to help bring relief to our families here in New Jersey. So thank you so much for the question.
Great. Thank you, Congresswoman. All right, we will get to our first live question this evening. This question is going to come from Priya from Milburn.
Yes, hi.
Yes, can you hear me?
Yes, I can hear you. Thanks, Priya.
Okay. Thank you for the town hall, and thanks for taking my question. So I have children in high school and also college going, and like you mentioned earlier, I appreciate all the resources we have access to, and the schools and colleges have been publishing a lot about access to these resources. However, that age group particularly, I know there's a lot of social stigma and embarrassment to really put your hands up and ask for help. So I'm curious to know if there is any evidence that children at this age group are indeed using resources, and to what can we be doing to encourage participation and use among that age group particularly?
Wow, that is a great question. As you can imagine, as someone coming from the military, really changing the attitude towards mental health services has been a struggle, especially in the wake of our many years of war, and you can imagine particularly among young men who like to think of themselves as too tough to need mental health services sometimes. I was particularly impressed when I was recently visiting one of our SEAL teams. I sit on the Special Operations Subcommittee to talk to the SEAL team commander about how everyone receives counseling, how he is very open about his counseling sessions, and how they use the counselor in the SEAL team to really help ensure people are getting the mental health services they need. And he really modeled that, which was a complete sea change, as we would say in the Navy, from when I served years ago. But as far as here in New Jersey, making sure we're getting young men especially to take, adolescent men to take advantage of the counseling and mental health resources, Dr. Koss, what are we doing to make sure that is happening? And Fred Douglas, if you have anything else to add after Dr. Koss.
It's a really important question, and a reminder that conversations like this help us to overcome the stigma, help us to incorporate discussions about mental health into any conversation about overall health. We do know that young people are using mental health services, and one of the things that we're learning is that we're more effective when we're meeting students where they're at. So 2 concrete examples that I'd like to share. We see that our schools are innovative in the ways in which they're bringing mental health services on campus so that students are experiencing this as part of their support network within schools, and students are able to speak with one another about the positive effects of speaking with counselors. We also here in New Jersey are very fortunate to have a New Jersey Pediatric Psychiatry Collaborative program. It is a statewide program that brings mental health resources into pediatricians' offices. So in that way, we know that all of our kids, including our older high school students, our young adults who are just transitioning into college, who meet with their pediatricians, are able to engage in a conversation about their mental health. This New Jersey Pediatric Psychiatry Collaborative, pediatricians are receiving more support and training to learn how to screen for and how to have these important conversations with teens, and then are able to phone regional mental health hubs to have access to child and adolescent psychiatrists for further consultation and evaluation, as well as further referral for ongoing counseling for those students who may have more significant needs and need that kind of individualized care. So these are some of the ways we're breaking down the barriers, overcoming some of the stigma that has historically existed.
Well, thank you so much. And Fred, do you have anything to add to that, what you're seeing in the schools?
Yes, I don't think we have enough time for what I have to say, but I'll do the best I can. We have a multi-tiered approach in schools, and we have had this for many years. Everyone gets services. That's why when I started, I may have mentioned that everybody on this call who has a child in a public school has a school counselor. K to 12, we are in all of the places where we should be. Granted that some of the elementary schools are vastly underrepresented in terms of numbers of school counselors based on the populations there, but children have just as many needs in the early years as they do in the middle and later years. But the school counselor is there K-12. We're providing services directly, either in small groups or individually, or in programmatic efforts. We work collaboratively with the teachers. We're in classrooms. We all know our caseloads. We communicate frequently with groups of teachers, with specific additional groups. We're maybe not visible to parents all the time. A lot of the things that we're doing is between communications that are occurring electronically or in passing in conversation that's private. That doesn't mean there's any secret being kept. It just means that we're in touch with our students. They're in touch with us. And we are using the resources at all times to improve and help all the social development of kids K-12. So while there's a big emphasis in the public right now about all the negative energy that's out there in terms of seeing somebody means you have a problem, that has long not been the case in school. We have been seeing and working with students, all the time, and needs have varied, and instead of having the higher level of care that certain situations justify, in so few cases, we're just now seeing many more of those. So there is a stretch and a demand on the outside resources for those people that are in need of unusually acute support or certain specific medical or other support. But that connection is being made immediately in many cases, if not, on the fly with teachers or nurses. So the communication is real. So it may be a mystery to some of the families that were unaware of it, or from families that don't have a good recollection of what does that school counselor do really. And I would just say, rest assured that if you make the communication, have the conversation, find out from them what the perspective seems to be for them, they'll be happy to meet with you, have a conversation about your child, discuss any concerns you may have, give you some ideas about things you might look for, ask you questions about the circumstances that can help them with your children. Nonetheless, though, I don't want anybody on the call to feel that when you don't hear news that, my child is not being seen or serviced. That's not the case at all. We've been seeing all of the kids all of the time in one way or the other. And so this is no different. It's just stakes are far higher, cases are more extreme, and the people that now have attention and realize who we are the most, fortunately, are people in public service, like our Congresswoman and many others who have now begun to realize the kinds of things we do on a regular basis. If you look on the American School Counselor Association website, right across the front page, you'll be able to see exactly what happens, what is a multi-tiered system of approach, who's doing what, when, and how, and pretty much we're all in line with that one way or another, even though specific locations vary with each local district. We're well connected with each other. Our county, for one, is 250 plus members right now. I'm in communication with them several times a week in large numbers or small numbers. For example, tonight before I came on this call, I polled every single one of them to get a take from them on what are some of the things that they would like me to represent here tonight. And I was, comforted by the fact that there were fewer than 10 who had suggestions, because the rest of them realized that I'm pretty in touch with most of what we're doing all the time anyway. So I'm very confident that what I'm representing to you is a kind of a broad brush reminder that your school kids are in good hands in a public situation, provided they have a counselor and that he or she is not involved in non-counseling activities. The recommendation we have is that 80% of the time that we're in the school, we should be providing direct service to kids. So, other things that are not direct service can sometimes come up. But if 80% of the time we're on task, you can be very comforted that your children are in good hands in school.
Well, thank you so much. Kelly, I'll turn it over to you for the next question.
Great, thank you. Our next question comes from Brandon from Chatham Township.
Yes, thank you. My question is about the trade-off that we make by actively engaging with our political process, actively engaging with our news media. It can be just so incredibly taxing to plug into these addictive media ecosystems and be just bombarded with all of the upsetting news and the inflammatory rhetoric, that there's this like real cumulative strain that it can take on our mental health and on our relationships. I'm just wondering if any of you have any pointers on how we can develop a healthier balance in our relationship with politics and with news media, and perhaps maybe you could briefly talk about some techniques that you might recommend for dealing with some of that strain. Thank you.
Well, thank you. That's a great question, and I'm probably not the best person to answer it, given that I became way too engaged and ran for Congress. But I'm going to turn it over to Bob in a second. But I will say, just as a reminder, our cable news media is a profit-making enterprise. So I think a lot of us of a certain age maybe engage with cable news as if it was kind of the 10 o'clock news when we were growing up, or the 5 o'clock news, which was a public service that the stations provided just to give the news. Now it is incumbent upon some of our cable news stations to really drive the narrative and incite emotions so that we'll keep tuning in. And unfortunately, sometimes those emotions involve a lot of outrage and rage, and I do think it is driving some mental health issues throughout our communities and driving divisions. So I hope that a lot of our community members can separate that from real political engagement, such as running for office or voting or working for a candidate that you believe in, versus sometimes the what we see on cable news and what we see on some of our social media, which really can, I think, divide us and at times cause some real mental health issues. But Bob, do you want to talk a bit more about that one?
Sure, I'd be happy to. Thank you, Congressman. First, I enjoy politics. I like to talk about politics. I read newspapers. I watch the TV news. But too much of anything can be a problem. And the first tip I would give is turn it off. If the news media is becoming overwhelming, or turn it off. If social media is becoming too much, disengage. In regards to politics, sometimes you have to turn that off. I happen to be a member of the Montclair YMCA, and I make it a point whenever I go there, when I talk to the other members, not to discuss politics, just to enjoy my workout and enjoy the other members' company. So my advice from a mental health perspective, and as a citizen as well, is sometimes we just have to disengage.
Well, thank you. I do think that is great advice. So I'll turn it back over to Kelly for the next question.
Yeah, and we're going to go to one of our pre-submitted questions. We had a number of questions on the topic of suicide, and this one is from Jeffrey from West Orange. I have personally known of 2 recent suicides that hit home for me, and I know of one person who is suffering through depression, and I'm really at a loss for how to help, or if I should help or can help.
Wow, thanks for that question. This is always one of the most troubling things. I think one of the worst days of my life was attending a funeral for a young boy who'd committed suicide in my town. And certainly as a veteran, far too many people that I've known over the years have committed or have died by suicide. And it's heartbreaking, especially among young people, where you can't help but feel if you could just get to them in the right way, turn them in a different direction. And we don't all have that opportunity. We don't all have that capability or that background. So I think the resources that we've heard about and continuing to to keep trying to drive our friends and family members towards those resources is very important. There is a lot of work being done to address this. So the CARES Act and the American Rescue Plan provided additional funding for community and school-based mental health services. So I could list for you the billions of dollars that we put out in federal funding across the nation to address so many things, but what that really means is making sure there are programs in our schools, making sure those programs about services and about warning signs, and that those programs get out to our family members, making sure, as the military has done, that on government phones, the suicide hotline, prevention hotline is on those phones, and mental health programs are pre-programmed into those phones, making sure we have the opportunities for people to get crisis counseling, like at Main Street or Newbridge, so really providing the on-the-ground resources to our community members. You know, the services are provided to the greater community, and in Essex, Morris, Passaic, and Sussex, there's a project to include a media campaign to increase awareness regarding mental health with information on where and how to find help. In addition to the ongoing challenges of the coronavirus pandemic, our withdrawal from Afghanistan for our veterans and the subsequent struggle to safely evacuate our fellow citizens has been a real challenge for processing what has happened in our country. So I've been working on the Vet Centers Mental Health Act so we can ensure that our veterans have better access to the mental health centers that many of our combat veterans use who've suffered from military sexual assault, bereavement services to family or service members who die on duty, for example. So we are working very hard to get more services out amongst the community because it is always just such a horrible, horrible tragedy. And I know that in these times of crisis, in so many, coming from so many different areas, the need is really sometimes greater than ever. So thank you so much for the question.
I'd like to point out, too, Congresswoman, that in the schools, New Jersey has the most rigorous requirements for harassment, intimidation, and bullying, reporting and investigation. And although it sounds horrible to say and to talk about that, what we do see in the schools specifically is that the vast majority of suspicious kinds of things where people think this one might be this or it might be that, vast majority of the situations don't reach that level of concern. There is a thorough investigation of the conversations and the lead-up that are brought to the attention of us. We have social media, checks with all the parties involved. There are, documented numbers of specific cases like those that give us markers, if you will, for disconnected students, from their friends and peers, and they're all very well connected on social media, so they do care for each other. They're well trained in what to look for and how to report and who to go to. So although we are all horrified by any of those events when they occur, we are definitely, like I said from the start, an optimistic place where helping each other is the way it works. And so when someone's having a difficult time and any of the people close to them are aware of it, the right level of appropriate confidential help is provided in a very quick and thorough way. Not a minute passes where a concern of someone's well-being is ever overlooked in a school setting, at least. So you may have less supervision and more concern at home. Phones are on all night. Kids are, doing things maybe when parents aren't aware. Some of those things can't be avoided from supervision standpoint in terms of the school, but we are on a very vigilant watch during the time we have children in school.
Thank you. And I just want to mention for all listening, if you do want to pass it on or if you need these services yourself, the National Suicide Prevention Hotline is 800-273-8255. That's 800-273-8255 for the National Suicide Prevention Hotline. Kelly, I'll kick it back over to you for the next question.
Okay, our next question is going to come from Sylvia in Verona.
Hello.
Sylvia, are you there? Yeah, we can hear you.
Yes, I am. Yes, thank you. Yes, thank you, Congresswoman Sherrill, for your thoughts about the importance of mental health, and to panel members as well. This makes for an easy way to dispense information. I'm wondering how we're doing in terms of staffing for mental health services. You know, I'm well aware, as I'm sure we all are, that we have a serious nursing shortage, and I noticed in some of the professional materials that come to my home that the list of jobs keeps getting longer. Do we have a shortage of psychiatrists, social workers, counselors, whatever? And if so, are there any plans underway to remedy that shortage?
Yes, Sylvia, thank you so much for calling in. We've heard throughout the COVID pandemic that the number of people who need access to mental health services is higher than the number of providers. So across all aspects, we're experiencing a provider shortage, but this is acutely felt for mental health providers, especially those providing services for adolescents. So that's why I fought to increase the number of residency positions for eligible graduate medical education payments under Medicare. This will help us get more trained mental health providers in New Jersey to provide the critical support to our residents. And it's also why I fought to protect access to telehealth. As you may know, during the COVID pandemic, healthcare providers adapted and provided telehealth services to serve the needs of millions of vulnerable Americans. And it's really been critical to healthcare access during the pandemic, and after the public health emergency ends, it's vital that our residents don't lose this access. So, for example, again, with some of our veterans, they have been receiving access to mental health services. We have a very, as you know, the most populated state in the nation. So with telehealth, we've been able to bring in services from other states, and then we've also had doctors who are certainly able to see more people. So I'm working and have several bills with bipartisan support to protect telehealth services even once the pandemic is over. Dr. Gungil, can you tell us a little bit about what you're seeing as far as the needs of workers in the mental health community and providers in the mental health community?
So while I can't speak specifically about that, I can speak generally about the public health nurse and other allied health shortages. And we are seeing a tremendous amount of my colleagues, for example, have resigned, have gone into other areas to do work so that they're no longer in face-to-face contact with patients. I've seen a lot of my colleagues with lists and lists of openings for nurses, for social workers, for health educators, and many of the allied health positions. So while I can't speak specifically about mental health, I can tell you that there is a shortage, and it's very concerning because we're losing a lot of human capital and knowledge as these people retire, resign, move on from the field.
From the field. And Dr. Koss, what have you been seeing?
As you mentioned, we do have a shortage of mental health professionals who are specifically trained to work with children and adolescents. This was a workforce shortage that we noted prior to COVID, one that's just been intensified because of the distress associated with current events. The support that you and other lawmakers are providing for an expansion of training slots and loan forgiveness for students who are accumulating significant educational debt going to go a long way in expanding our workforce. I also, as a physician, also want to comment on telehealth as we have seen this to be a very effective way to expand our reach. Telehealth has allowed mental health providers to connect with individuals who are in rural or more remote parts of our state, allowed us to connect with individuals who have not been able to travel to specialty care centers. And with the special provisions around telehealth through the pandemic that have allowed us to use audio features, low-tech features, we've also been able to connect with individuals who may otherwise not have had access to high-tech broadband technology for telehealth. So these provisions were put into place swiftly during the pandemic, but again, lessons learned. We hope that the lessons learned will continue beyond the pandemic so that we can continue to provide quality care to all of our residents.
Well, thank you so much, and that's about all the time we have for questions tonight. And I really want to thank again Dr. Koss, Dr. Gungil, Bob Davison, and Fred Douglas for joining us for the telephone town hall tonight. You've all been such great support, really, for all of us in the community about where we can go for help and how to do that. If we didn't get to your question tonight, my team and I are ready to help get you an answer. So you can email my office at sherrill.house.gov/contact or call our offices. Our DC office number is 202-225-5034, and our district office is 973-526-5668. My casework team has been monitoring questions and will reach out to people as needed to see how we can help. You can also follow me on Facebook for the latest updates from my office. I also have a newsletter with updates on my work in Washington, which you can sign up for at sherrill.house.gov. Before I close, I wanted to remind you all that there is still time to send Valentine's cards of appreciation for NJ11 frontline healthcare providers as part of our Valentine's for Healthcare Heroes. You may have heard a lot about how thankful everyone is for our heroes, but I also have talked to a lot of workers on the front line. They have really been in a crisis situation for several years now, and as many people in the community are feeling done with the crisis, occasionally they do unfortunately take it out on some of our healthcare workers. So we're working to get Valentine's out to remind them of how much we appreciate them. The deadline is Wednesday, February 9th. You can mail or drop off your cards at my office at 8 Wood Hollow Road in Parsippany, and we'll be distributing the cards in time for Valentine's Day next week. So thank you all again for joining today. Stay safe, stay healthy, and take care. And if you are in crisis, please call, and we can help direct you to the resources you need. Thank you again, and have a great night, everyone.